Just got your new tissue mapper and ready to dive in? Here's everything you need to know to get started the right way. First, we're going to cover how to register the tissue mapper pointer in the software, when to use a tissue mapper, how to use the tissue mapper, utilizing that data in exocad, and then sterilizing the pointer. Registering this new probe in the software is quick and easy. Simply open the MicronMapper application, click on More, then select Register New Tissue Mapper Pointer. Look at the pointer and locate the series and opticode number. Enter both values into the software and click Download and Register. Your tissue mapper is now added to the software. But there are a few important things that you should know before you begin. The tissue mapper is really only designed to replace post-op tissue scans. It's not meant for stage 2 scans, and currently it only really works with the CBCT bite technique. So if you're using bone fixation screws or the TAD workflow, this isn't really the tool for that. The tissue mapper pointer includes a detachable tip that must be firmly attached before use. This prevents the tip from falling into the patient's mouth. Listen for a distinct click when it locks into place, and always double check the tip is secure before starting any procedure. After surgery, take a standard MicronMapper scan using the split scan bodies for the implant positions. Once the scan's complete, show the pointer to the camera and the software will automatically switch to the tissue mapping mode. Make sure that the scan bodies and the tissue mapper pointer body are both visible to the camera. Place the tip of the pointer on the gums near a distal implant and hold still for a few seconds until the first point registers. Continue to work your way around the arch, adding points. At minimum, it's recommended that you place a point on the distal and mesial side of each implant, but more points equals more data. If you need to remove a point, simply use the computer's mouse to hover over a point and click on it. If you need to restart the scan entirely, click Restart Mapping. The amount of pressure applied to the gums during tissue mapping should reflect the desired positioning of the intaglio surface on the prosthetic. Insufficient pressure may lead to excessive space between the prosthesis and the tissue, while too much pressure could result in a prosthetic that is too tight. Just use your best clinical judgment here. Since both implant and tissue data are captured with the MicronMapper, they'll export already aligned and can be used directly as the jaw scan in exocad. I recommend setting up the case as scan body and main scan because the tissue and implant data are already combined. After aligning the MicronMapper data to the segmented CBCT, choose the split scan body option in the exocad library along with the screw or tie base you want to use and detect implant positions just like normal. Remember, if the doctor already applied the requested tissue pressure with the pointer, it's important that we don't apply additional pressure using the basal feature. Just cut it flush and smooth. It's critical that the scan bodies and tissue mapper pointer are properly sterilized. To find the full instructions with autoclave times and temperatures, simply open the MicronMapper software, click Docs, open Documentation folder, and read the MicronMapper instructions for use. Do you still have any questions about the tissue mapper? Reach out to our support team or contact your local sales rep. We're here to help.